Are you okay, Isabel? You seem a bit anxious. Okay, let's try and take some deep breaths together. Breathe in, do it with me. 2, 3, 4. And breathe out. 2, 3, 4. Breathe in, breathe out. You seem very anxious about this.
This is really not going to help me.
Isabel, the food will help you recover. I'm aware that you have a lot of goals and things that you would like to do outside hospital. So overcoming these fears in treatment will help you reach these goals sooner. Okay, let's break it down into steps. I would like you to pick that slice and start to take a bite, just like me. Don't smell it, just take a bite. Have you got any plans for this weekend?
I don't think that's going to help.
Okay, we don't need to have a chat if you don't want to. What else would you find helpful?
I just think I need to not eat pizza.
This is your nutrition, Isabel.
What is nutritious about that?
It is part of your prescribed meal plan. Think about it like if it's your medication.
And what's going to happen if I don't eat it?
Isabel? Hi Isabel, it's me, Miriam. I'm just gonna get closer to you so I can hear you. I understand that this is a very, very difficult situation for you. At the moment we have two options. One would be to go back to the dining room and finish your main meal and dessert, or we could also go back to the dining room and have a supplement drink as a replacement.
I'm not having it!
I understand, but we are here, we are going to be here to support you, but it's so important, Isabel, that you are able to face these fears on treatment. Okay, let's do some grounding together, and let's see if we can think about 5 things that you can see.
This is so stupid.
Let's try and give it a go. 5 things that you can see.
The flowers.
Mm-hmm.
The clock.
Yeah.
The cushion.
Yeah.
The tissues.
Yeah.
The sofa.
Lovely. You're doing a very good job. Now let's think about 4 things that you can feel. What are the textures?
The rug.
Yeah.
Bubbles on my trousers. The beanbag.
Yeah.
The elephant.
That's good. I can see that you are feeling a bit calmer, and I think it would be very good if we could go back to the dining room. It is never too late to try again. Do you think we will be able to do that?
Yeah.
Okay, let's go. After you. Okay, let's come back in. Could you please pick up your chair? Isabel, would you like me to give you your sensory toys to help ground yourself? Okay, would you like to listen to the radio instead? Okay.
I'm not eating that.
Hold on, Isabel. We are not quite there yet. Could you please sit down and finish your crust? We also have the dessert to complete.
No, I'm not eating it.
Okay, Isabel. Okay, let's come back in. Would you like to pick up your chair, please? Would you like to have some sensory toys to help you ground yourself?
No, I'm not going to eat anymore.
You've just seen an example of meal support delivered in a one-to-one setting. However, most often clinicians will be supporting groups of patients. It's important to be mindful of supporting patients in a group setting. You need to engage the whole table if you can, and if you're finding a patient's behaviour challenging, in order to protect their dignity, it might be important to have a conversation with them outside of the dining room. Many patients with eating disorders make comparisons between themselves and other patients. So this can quickly create friction or even competition for care in the dining room.
I didn't find it so helpful when staff didn't remain calm. So I would often get quite frustrated, and if staff spoke to me in a tone that I found aggressive, then it would... If staff spoke to me in a tone of voice which I found confrontational, then it would escalate my emotions and cause conflict, which obviously wasn't helpful in the dining room.